Hey guys, today my group will be presenting on the topic of developmental dysarthria. To start off, we have 3 goals for you. Goal number 1 is that by the end of this presentation, you will know how to define and identify the characteristics of developmental dysarthria. Goal number 2 is that you guys will know how to assess developmental dysarthria. And goal number 3 is that you will walk away knowing more about the various types of treatments for developmental dysarthria. So, what is developmental dysarthria? Well, it is a group of motor speech disorders resulting from neurological damage that can affect all parts of speech. Here are the parts that it affects. Articulation, which is the movement of a speech mechanism in order to produce a sound. Resonance, which is the forced vibration of a structure. Phonation, which is the production of voice through vocal fold vibration. Respiration, which provides air supply necessary for speech production. And prosody, which is variations in rate, pitch, loudness, stress, and rhythm. Now we are moving forward to the different types of developmental dysarthria, specifically the 4 that occur in cerebral palsy. The first being spastic dysarthria. This is the most common. It occurs in about 70 to 80% of children with cerebral palsy. It is characterized by increased muscle tone, exaggerated stretch reflexes, and slow, jerky, voluntary movements. The next is dyskinetic dysarthria. This type results from extrapyramidal damage, which is damage concerning motor activity. This occurs in about 15% of cases. It is characterized by abnormal patterns of movement, including involuntary and uncontrolled movements of the entire body. Now moving forward, we have the third. This type is ataxic dysarthria. This type is less common, occurring in a low 5 to 10% of diagnosed cases. It is caused by damage to the cerebellum, but it is mainly characterized by a disturbed equilibrium. It affects the force, rhythm, and accuracy of all movements of the body. Lastly, there's mixed dysarthria. This occurs in about 30% of all cases. It is a combination of more than one type, the most being a combo of spastic and athetoid types. Although this paralysis is mixed, one type is usually more predominant. There are 3 additional types of developmental dysarthria aside from the ones in cerebral palsy. Number 1 being flaccid dysarthria. This one is characterized by hypernasality, harsh voice, breathiness, monopitch, short phrases, and indistinct articulation, which especially affects plosives and fricatives because of the poor intraoral pressure. Number 2 is hypokinetic dysarthria. This one is characterized by repetition of phonemes, repetition of syllables, mild hypernasality, reduced vital respiratory capacity, irregular breathing, hoarse voice, reduced stress, inappropriate silent intervals, and short rushes of speech. Lastly, number 3 is hyperkinetic dysarthria. This one is characterized by distorted vowels, inconsistent articulatory airs, voice tremors, harsh voice, excessive loudness, variations, prolonged interword intervals, and sudden forced inspiration and expiration. Last but not least, we have the etiology or the cause of the neurological damage leading up to each type of developmental dysarthria. This can be various things like strokes, progressive neurological disorders, metabolic disorders, and even inherited disorders. Also, among children who show dysarthric speech are those who may have cerebral palsy, as we discussed before, traumatic brain injury, tumors, and strokes, with cerebral palsy being the main one. Now you guys will be moving on to the assessment and treatment of developmental dysarthria.
Okay, hello. So when it comes to developmental dysarthria, it's just really important to understand that assessment is very crucial in beginning the treatment in a way that the clinician and patient can kind of just meet each other at one point. The clinician can kind of just meet the patient where they're at and know where to begin for treatment. And so there are about 4 guidelines that the clinician should know before assessing them. And the first one is to make sure that the patient is sitting upright in a way that they have good breath support for their speech. Number 2 is just to make sure that you're in a room with good lighting so that both the clinician and the patient can see each other's mouths well. And then number 3 is, of course, make good eye contact. And number 4 is to eliminate all distracting background noises. So if you're like in a room and the door is open and there's like a noisy hallway, just make sure that you close it. Or if there's a TV going on, if there's a TV on in a room, just make sure you close it, because we're trying to just give the patient an environment where they don't have to compete to be heard. And then, so for the actual assessment, although there are numerous formal assessments, one of the most notable ones is the Developmental Dysarthria Assessment, 2nd edition. It's also called FDA2, and this assessment is divided into, well, the first part is the facial oral motor tests, and then the second part is just a test for intelligibility. So, the oral motor assessment is divided into 6 different sections. Number 1 is reflexes. So, you are going to do ratings for their cough, swallow, and if there's any like dribble drool going on. And then number 2 is respiration. So, you're going to do ratings for when they inhale and exhale, like just regularly at rest, and then how the respiration is in their speech. Number 3 is lips, so you're just going to do ratings for when they're at rest, when they're spread, sealed, alternating, and in speech. Number 4 is palate, so you're going to do ratings for how they do when they have like fluids in their mouth, maintenance of food, and in speech. 5th is laryngeal, so this is just testing for like the intonation in their voice. So you do ratings for time, pitch, and volume in their speech. And then last is the tongue, and then you're just going to rate it so when it's like at rest, when it's protruding, when it's going from side to side, up, down, and as always in speech. And so the last part of the assessment, number 7, is to test for intelligibility. So this is just seeing how well you understand their speech within words, sentences, phrases, and just regular conversation. So today we are going to test for the oral motor assessment. We're going to test the lips and the tongue of my client, and then we are also going to test intelligibility in words. So today we are going to be doing the assessment, and I'm going to be the clinician, and this is going to be my client, Bree, and we are going to be testing for oral motor abilities in the face and for intelligibility. So we are just going to exemplify 2 of the oral motor tests, and we are going to be doing the lips and tongue. So we're going to start off with the lips. So I just want you to blow air into your cheeks and keep your lips puckered, and keep it there for 15 seconds like this. Can you do that? Okay. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, awesome. Good job.
Thank you.
Okay, now the second lip activity we're going to do, or the lip test that we're going to do, is alternating, in which it's going to look like this. Okay, so I want you to say ooh, ee 10 times in a row like this. Ooh, ee, ooh, ee, ooh, ee, ooh, ee, ooh, ee, ooh, ee, ooh, ee. Can you do that for me?
Ooh, ee, ooh, ee, ooh, ee, ooh, ee, ooh, ee.
Okay, good job, you got it. Okay, awesome. The next one we're going to do is with the tongue. So I just want you to keep your tongue just hanging out at rest for 10 seconds, like this. Okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, awesome. So here you're just going to be testing, like, if it moves to one side, if it's shriveled, abnormal coloring. And then now I want you to just move your tongue from side to side 5 times, like this. Can you do that for me? Okay, awesome. And now the next one, we're going to be testing for alternating tongue movement. So I just want you to say ka-la about 10 times, like this. Ka-la, 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 ka-la.
Ka-la, 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 ka-la.
Okay, awesome. And now we're going to be testing for word intelligibility. So the way we're going to do this is that we have about like 12 speech cards, and then you have them face down, kind of just shuffle them in front of the client. So, Bree, what I want you to do is just flip one over at a time, and then I want you to read the word to me, okay?
Okay.
vote. Safe. Time. Thumb. Mess. And big.
Okay, awesome. And so here we were just testing to see how well you understood the words without knowing what the words were. And yeah, that's going to be our assessment for assessment for developmental dysarthria. And again, I was the clinician Rhonda, and this is my client Bree. And thank you for watching.
I will be talking about the treatment within dysarthria, and treatment depends on the cause, type, and the severity of the symptoms in each individual, and an SLP will work with the individual to help them with improving their communication abilities. And an SLP should have in mind different goals depending on the person. Some of those goals include first, such as slowing of the rate of speech. Another one is improving of their breath support so the person is able to speak more clearly and loudly. Another one is strengthening muscles because due to weakness, some may have weakness in their mouth, and therefore strengthening muscles is a good goal to have. And a fourth is increasing tongue and lip movement. Another one is improving speech sound production so the speech is more clear, and not even helping with the individual with these in treatment, but also treatment can apply to others around them by helping, such as caregivers, family members, and the teachers around the person with dysarthria, teaching them these treatment processes or exercises so that they are able to also help the individual who has dysarthria improve in their communication abilities. In the following, I will be discussing different treatment exercises that helps with dysarthria, and the first one is a treatment to improve intelligibility. The second one will be a treatment exercise for improving respiration. The third will be a treatment exercise targeting phonation. The fourth, a treatment for targeting the rate of speech. And lastly, a treatment exercise focusing on prosody, targeting stress and intonation problems. So here I'm with Rhonda, and we will be doing some treatment exercises, some of the more common ones. The first one is treatment to improve intelligibility. And so I, as a clinician, I'm going to have you read these words, and you're going to have to emphasize the consonants on the words. So read this one.
Hot dog.
Okay, next one.
Beige ball.
Okay, so that was again to help improving intelligibility and seeing if they knew the word without me prompting them to. And the second one, the second treatment, is helping them with a respiration. So this is a treatment for respiration, and this is targeting the symptoms of shallow breath support common in patients with hypokinetic or flaccid dysarthria. And this technique is called cueing for complete inhalation. And I'm going to remind the patient to inhale fully before speaking, and then they're going to say the sentence. So before you read the sentence, take a deep breath in, and then read the sentence. So.
The boy ran down the road.
Okay, that was good. So this again is helpful to increase the client's breath support by inhaling their accumulating breath and then exhaling while they're saying the sentence. A third one is phonation treatment, and so this is targeting the phonation, and the treatment is called the yawn sigh exercise. So the patient is asked to inhale slowly while opening their mouth fully, like a yawn effect, and then exhaling like with a prolonged sigh. And so I will ask you to inhale as if you were yawning with a wide mouth. Yeah, good. And exhale, creating a long sigh. Good. This can help clients with spastic dysarthria because the yawning motion will facilitate relaxation. So for the two next treatment exercises, we will be doing it with my mom as a client and I the clinician. And so the first one will be a treatment to help reduce the client's reduction in the rate of speech. And so this is targeting the symptoms of poor intelligibility and helps to lessen the perception of hypernasality and to control the rate of speech. And so I, as a clinician, will have you read a sentence, and you will say the word of the sentence as I tap. So you can start by reading the sentence.
I love my daughter very much.
Yeah, good job. And thank you for loving me, Mom, as always. And so this treatment exercise will benefit patients with flaccid dysarthria, but also ataxic and hypokinetic, in that you're working with the rate of speech control. And this exercise helps and allows the articulators to have extra time to reach their target points in the mouth, resulting in a more precise articulation of phonemes. And so this final example of a treatment exercise will be focusing on prosody, and it will be targeting stress and intonation problems. And this treatment is called the contrastive stress drill. And this involves the clinician asking the client a question in which he or she will answer by adding stress to the keywords to convey the intended meaning. And so I, as a clinician, I will ask you to tell me what the picture is by the question that I ask you. And so looking at this picture, is this a girl playing football?
No, the boy is playing football.
Yeah, that's correct. And so this treatment exercise will benefit patients with either ataxic, spastic, flaccid, or hypokinetic dysarthria, and it will help develop more natural pitch and loudness variations and connected speech. So that's it. Thank you, Mom, for helping me with this project.
You're welcome.
Love you.
Love you too.
Bye.